My name is Jonathan, and I need these lips to become bigger and even more beautiful. I was 6 years old when I moved from San Francisco to Vancouver, Canada. Growing up, my mom got me a male doll. He had, blonde highlights in his hair. He had blue eyes. I just thought he was perfection to me, and I really wanted to look like that. After that, I started wearing makeup, and I started going tanning when I was in grade 11. You will never catch me pale. I never walk around or leave the house without a spray tan. I obviously fill my eyebrows in. I put false eyelashes on every day. Use lip liner to overdraw my lips to make my lip look even bigger. I always wear my color contacts and I always have highlights in my hair. I am obsessed with looking fake. It's perfection to me. I think it's attractive. People are drawn to you when you look fake. Growing up, my lips were definitely smaller. They were just very simple and basic looking. On my 25th birthday, I called the doctor to make an appointment and got my first lip injection. I thought it wasn't big enough. And I went back after a month and I told them the size that I want my lips to be, and they refused to put that much fillers in my lips. It was dangerous. I know it's not dangerous. I've seen people with bigger lips before. I walk into the room, I need to have the biggest lip in the room. I think that my lips have brought a lot of attention to me, and I definitely love that attention, and I don't want that attention to stop. If my lips were not this big, I think I would definitely be in depression. I think I would look in the mirror and think that I look super basic and super simple. I don't want to look basic. I'm not gonna go from a glamazon to a basic girl. I think that it'll make me a lot happier if my lips were bigger. They're just not big enough yet. And I am determined that Dr. Dubrow and Dr. Nassif can give me the lips of my dream. Don't splash the water.
We need a little refill over here.
One of my hobbies is definitely day drinking with my friends.
I love the white eyeliner. Dang.
I mean, look at this glam, look at this tan, honey.
6 pounds later.
Love laying by the pool, I love to party. I just like to have a good time. Don't you love my new hair?
Looks great.
Can we talk about this tan for a moment? I have 5 layers of spray tan on right now.
I'm jealous. It's funny that you live in Canada and you're more tan than I am.
Hey, gosh, stop. I have so much glam on right now, okay? My hair and my face.
He's not housebroken yet.
I've been thinking about getting my lips bigger.
How much bigger?
I don't even know what's the size that I want. I just want them bigger, you know what I mean?
Really?
I feel like every time I get them bigger, I just keep wanting them to be bigger and bigger. People are always like, you have so much fillers in your lips. I'm like, no, I don't. They're just not big enough yet, and I don't know why they keep telling me that they're so big, because I honestly don't think they're big. I mean, look at it, they're not that big. Like, my lips are not that big compared to a lot of people.
Like hashtag natural.
Hashtag basic.
They are.
They are basic. Well, there you go. You just said it. Then there you go. I need more fillers. I don't want to be basic. You know I'm not a basic girl.
I see your lips and I'm just like, man, I need a little bigger.
I like them.
Thanks.
I think you should go bigger.
Do you? Of course you do. Maybe one more vial.
Oh, maybe 2. 2.5.
Oh my god, they might explode.
Let's talk about Jonathan.
Wow.
All right, so he's got some little contacts going.
He's had a huge amount of filler in his lips.
Look at the little bubbles from the filling. Yeah, he's got that whole duck lip going on. So I wonder what he's here for. Does he want him reduced?
Well, he's had a lot of things done.
You look at him, go, well, that's a lot of that's makeup, though.
See if we could help him.
Can you please send in Jonathan?
Hi, doctors.
Jonathan,
How are you?
I'm Dr. Nassif.
Nice to meet you, Dr. Nassif.
Terry Dubrow, nice to meet you.
Dr. Dubrow.
Please have a seat.
You guys are even more handsome in real life.
Really?
Yeah.
Go ahead, make your comment.
Is he larger in real life than you have seen pictures of him?
No, I think smaller. Yeah, smaller.
Really?
I get better looking as I get older, just like a fantastic Bordeaux.
Where are you from originally?
I am from Vancouver, Canada.
What do you do for a living?
I don't work. Yeah, my boyfriend takes care of me.
Your boyfriend takes care of you.
Well, I take care of him too, in a housewife kind of way. My boyfriend goes to work, so usually I either go hang out with my friends, I go shopping, or go tanning. Basically just all taking care of myself, just the life of a housewife. Now I just need you guys to give me that lips to give me that look.
Is that why you're here?
Well, yeah, I want my lips to be bigger. Obviously, I have fillers in my lips right now.
Why do you want fuller lips?
Growing up, I've always been obsessed with dolls, and I really wanted to look like that. So when I was 25, I started getting Botox and fillers. So I became obsessed with lip injection. And ever since then, I've been going every 3 months. Every time I want to get 2 vials, but the doctor always talked me into getting 1. She was like, well, girl, you have a lot of fillers in your lips. And she wouldn't do a full vial for me. She gave me half a vial. But what I want is every time I go, I want one vial on the top, one vial on the bottom at least.
So you know we're a reconstruction specialist.
Yes.
We actually take care of patients that have been botched. So you haven't been botched, per se.
No. Obviously, I have fillers in my lips right now.
How much in each lip?
Well, in the past 2 years, I've got about 11 vials in my lip.
A half vial should translate into a half cc. There's 1 cc in a syringe usually. I think Jonathan is getting filler a little bit too much every 3 months.
So you like to keep them at this size?
No, I want them bigger, but they wouldn't do it for me.
Why did they
yeah.
tell you they wouldn't do it?
They said it was dangerous.
What did they tell you was dangerous about it?
I forgot, I don't know.
So you
I
actually
wasn't even
came to
listening
us.
when they started telling me it was dangerous.
Are you able to actually close your mouth? Partly. Jonathan has what we call lip incompetence, which means he can't close his lip to a perfect seal. That means he already has too much filler in his lip, and to go any further could cause him very significant problems.
If you put so much filler in your lip, you're gonna hurt the blood supply to your lips.
If you block the blood vessels going to the lips, what do you think happens?
The skin's gonna be dead.
Bingo.
Yeah.
And then what happens?
I'm gonna have no lips.
Bingo.
Let's get Jonathan an exam chair because I got to examine his lips. I want to make sure that he hasn't done any damage and also hopefully prevent him from doing damage to his lips.
Let's
All right,
go.
fantastic.
Yes.
Okay, so should we see what's
some,
going on?
Let's do it.
I'll tell you, they feel really tight.
I actually can't feel much, to be honest.
You know those breast implant patients that the skin is pretty much screaming in pain?
There's so much fillers in my lips, honestly. Sometimes I feel like it kind of blocks the sensation.
We talk about lip anatomy. There's a dry border and a wet border. The
Okay.
wet border is just that portion that's on the inside.
Okay.
What you've done is you've everted it so much that the mucosa, the lining that's supposed to be wet, is now not exposed to the inside of the mouth enough, so it's very dry. As you place filler in the lip, it can evert the lip, exposing the inner wet zone to the dry environment, causing inflammation. That's why you have to be very careful how much filler you place in the lip so as not to evert it too much.
So let's say you inject here and here. All that extra weight can possibly take your lip and go like that. And that means you won't be able to close it. Would you like that?
No.
If you inject more in here, it won't necessarily go here because you've reached the limit of the ability to put it exactly where you want. There's certain compartments that are just full. And unfortunately, I don't even think this is achievable. If you have more, your symmetry is gonna get worse.
Yeah, we're not gonna be putting any more filler in Jonathan's lips today. A little bit more filler inside your lip can possibly compress one of those blood vessels that feeds your skin to your lip. Once that happens, you get tissue necrosis, tissue death.
We have both seen someone get too much filler in here and the entire cheek goes completely black. We don't want that to happen to you.
I don't want that to happen to you too.
So what are the chances you're gonna listen to us and not do it?
I still want to go bigger with my lips. To be honest, it doesn't really scare me much. I think I'm still gonna keep going and get them bigger. I mean, I know that there are people with bigger lips than me out there, and what's gonna make me happy is getting bigger lips.
We think you're very, very close to that tipping point where you could go from okay to complete disaster.
And then from there, you'll never be the same again. What other picture can I paint saying that, hey, your lips are gonna die, they're gonna turn black, and they're gonna fall off? And he still wants to do more fillers? There's nothing else I can do.
Thank you so much, Doctor.
Listen, thank you very much for coming on here.
Thank you. Thanks, guys.
Take care.
Bye.